I like and welcome one and all to the MSA Crusaders call. Voices strong, spirits bright, join us as we ignite. We're here to share, to inspire, to lift each other higher. With stories of strength, voices that shine, this is our journey, yours and mine. You're tuned into MSA Crusaders, where awareness begins, one story at a time.
Hi, I'm Daisy,
Hi, I'm David.
and we're the MSA Crusaders.
Hi, welcome back to MSA Crusaders. Today we're here with Paul Gibson. He's going to talk to us about medical fatigue and PTSD.
Welcome, Paul.
Thank you for this opportunity, David and Daisy. I really appreciate it.
Paul,
I would like to discuss the effects MSA has on us as individuals, mentally and psychologically, help others understand how to alleviate some of the anxiety associated with MSA and how to better manage all of the doctor's appointments, medications, potential drug trials, and try to find balance in life at the same time, which is important because I've been given 2 years. That's what the doctors have told me based on my urological, gastrointestinal, and other issues that I'm facing, and the 65 pills that I take each day for multiple system atrophy and the effects that they have on my body as well.
when were you diagnosed?
I was diagnosed in March of last year, and I got a second opinion in July.
And when did you start having symptoms?
I started having symptoms. REM behavior disorder is something that I've carried throughout life since I was probably in my late teens, early 20s. And then I started having low oxygen. I started more so about 5 years ago having bowel and bladder issues. And that's when the pieces started coming together. And doctors and specialists were saying that I potentially had a neurological disorder. And the first couple weren't quite sure exactly what was going on. And it was a sleep study specialist that observed my REM behavior disorder that and the data that they got from the sleep study that perhaps I had something more sinister, such as Parkinson's, but he felt that I had multiple system atrophy. And he referred me to a specialty clinic at VCU in Richmond, Virginia. And that's where I was diagnosed.
So, Paul, you and I are very similar on a lot of symptoms and things we've done with MSA. And I can tell you for a fact that your REM behavior disorder from an early age and my ADHD from an early age is all due strictly to a lack of dopamine in the brain.
Exactly.
Dopamine is what we stopped producing with MSA on top of the destruction of nerve cells and stuff, glial cells and stuff. It's not you and I did not have not had MSA since we're a kid, but those were definitely something was wrong in at a young age, and only recently have we been actually got the other autonomic system issues that actually confirmed it. I just want to make that clear to the viewers that we're not trying to say we had it for 25 years, but we have had a lack of dopamine, which does not help when we get MSA because you need your dopamine to keep going.
But yet the carbidopa and levodopa doesn't have any effect on MSA patients. So we need dopamine, but how do we get the dopamine?
I take Retard.
Daisy takes a different medication that she just helps her.
And it is a time release to carbidopa and levodopa.
Yeah, so she's using a dopamine antagonist. So dopamine antagonists like levodopa, carbidopa will work for 10% of MSA patients, but it's very short lived, like only a couple of months, and then it falls off. So yeah, Paul, basically what you said is absolutely true. It does not work for MSA patients, and if it does, a couple months.
I've been on it for 4 years.
Yeah, that's crazy.
I'm in the 10%.
Yeah, it's it.
Yeah.
1 out of
So
4 would be carrying the disease, and I'm 10% the carbon.
well, if it was actually helping, you would be not losing all your speech and walking and other functions though. So is it really helping?
It helps me with the tremors, and it helps me with the rigidity.
The tremors and what? Rigidity. Yeah, I can't say a word with my lips either. Yeah, well, but that's not. Yeah, but if it was actually replacing dopamine, like leaving
Yeah.
up carbidopa,
I go out.
yeah, we would be practically normal.
I have extreme weakness on my left side.
Nice.
That's my biggest issue. I use a combination of trekking poles for around the house to a rollator in public if I'm going to um, be in an open space for 15 or 20 minutes. And
Be
then,
careful that roller get away from you.
and then if I'm going to be somewhere longer, then I have a power wheelchair that I will use to navigate and to conserve energy. And I think that's important too with MSA is energy conservation, because we're only given but so much in a day. And once we have expended our energy, that's it. I
Yeah.
don't know
Yeah.
how you are, but for me anyway, if I perform a task and overdo it, I'm shot for the rest of the day.
That's me.
Nothing left to give.
Yeah, I was telling Daisy about my dishwasher. I just put in, and I got half of it done yesterday, and it took the soul from me. I mean, you're right. You know, I wake up and the first thing I look at is my health tracking on my Samsung and my other devices, and the energy score, the sleeping score is for me is pretty very accurate. Today I woke up with a lot of energy, but for one day I'll have like in the 80s as far as energy. I'll have 4 or 5 straight days in the 40s, 50s, and 60s where I wake up as tired as I was when I went to sleep. So you're right, Paul. Like me just trying to do the husbandly thing in the house and installing a dishwasher, which is not very hard, by the way. we had one there to begin with. I mean, literally halfway through it just zaps you out, and that's like on my our product podcasts and videos. Like my voice right now is gone for the most part because I finished the dishwasher this afternoon, and my wife is there trying to help me get off the floor because I have absolutely no energy or control to use my muscles to get off the floor. So I completely understand about conserving your energy. Especially if we have trips or visiting people, cruises, or going on flights. So to me, the worst thing that kills my energy is walking through the long airports. Not only not only does the stimulus of the lights and the stores and the people in your way and stuff make you tired, but also all the walking. I mean, I went to Home Depot looking for a light for my front porch, and looking at all the lights on the wall stripped from me my energy, my soul. I told my mom she was visiting. I said we have to leave Home Depot quick because I'm going to pass out. Just looking at the lights for like 20 minutes just did it for me. So yeah, energy conservation is something that's widely overlooked.
Oh, you
Yeah.
take your power share out and about?
I'm sorry, Daisy.
You take your power share out of the house?
I take my power chair out of the house, yes.
What
I
kind of
installed a
vehicle do you have?
lift on the back of my truck and
There you
strap
go.
it down, and I'm able to take it most anywhere.
That's nice. Is it one of the heavy duty, the 6 wheelers or whatever?
It is. It's the Permobil 6 wheel. It's got two central motors with wheels on the back and small wheels on the front, but it's mid driven, so I'm able to fully recline. I'm able to lift the chair so I can reach taller cabinets. And if I'm in a public place, I can raise myself up so that people acknowledge that I'm there and don't run over top of me because
Yeah.
I'm at an eye level to them at that point. And it's very, very maneuverable. I also have a smaller, manufactured by Journey, a folding portable power chair that's quite good as well, but it has much smaller wheels and doesn't offer the maneuverability as the larger Permobil does.
And did Medicare pay for either one of those?
Medicare paid for the majority of the Permobil. I paid out of pocket through Facebook Marketplace for the Journey and got a really good deal on it. And I keep it in the back of the truck always and keep a battery charged up so that I can have the flexibility to either get into my vehicle and go and use the Journey if I need to, or if I know that I'm going to require the Permobil, I'll go ahead and load it on the lift on the back of the truck and take it with me.
So you said get into your vehicle, so you can still walk?
I can walk using trekking poles. I'm good for about 15 minutes or so, but in a at best, it's more like a drunken state. I've drop foot really bad on my left foot, and I stagger and I wall walk a lot when always wall walk in the house. But if I'm in an unfamiliar space or something, I use a rollator typically for short distances. So
Careful
yeah,
with that roller.
I'm still able to walk just very short distances and not in a very safe manner.
You'll
Well,
bat the dust in that roller, though, so be careful.
yeah, Paul, I commend you for at least still trying. It's not do not give up on walking. It's
I'm not going to give up on anything.
good.
That's kind of my mantra. We were talking about aspiration earlier. I've got something lodged right now, so excuse me if I cough. I'm not going to give up on anything. I'm going to give it 110% all the time. But I also am well aware that when the right side of my body doesn't respond to commands, to move my right toe or lift my right foot, I'm going to stop
Yeah.
driving at that point. I say I'm okay with it, but I don't know what I'm going to feel like when that time comes. But I'm currently at peace with it. I know that it's coming down the road. I just don't know when. Until then, I'm very capable of driving. If there's a time when my medications make me feel a little woozy, I won't drive.
I haven't drunk since 2019.
Wow. How about you, David?
Still drives.
Ironically enough, the same month I I had symptoms. I bought me an SUV that was fully loaded with all the anti-collision, hits the brakes for you, it'll follow the cars in front of you, everything. I bought a vehicle that I did not need with too many safety features, and it comes to find out years later, thankfully, because of that, I can still drive very well. But like you said, Paul, when I'm fatigued, which is half the day at least, I'll ask my wife or my daughter to drive.
Exactly. Yeah, same for me. I'm very careful when I drive. Mornings, I'm usually fresh unless I had a really bad REM behavior incident during my sleep, and which happens 2-3 times a week. I'll become very combative, and
I'm glad you said that because we don't. Everyone asks in the forums, is REM behavior disorder like every day or every night? And it's not. Some people have it every night. Some people have it once every couple of weeks. And you're saying you have it 2 or 3 times a week.
And that's with the uptick in the Klonopin that I take. At first, I was on 1 milligram, and I was quickly moved up to 2 milligrams, and that seemed to work for a few weeks. And then I started having REM behavior incidents again, and so they bumped it up to 3. And there's room for me to move up to 4 milligrams a night. But then it
What is
becomes a
it?
real question on, are you going to wake up the next morning or not?
Are you
is
going to
it?
stop breathing?
Are
Yeah.
you going to stop breathing in the middle of the night? I'm on full time supplemental oxygen at during bedtime. I take 3 liters at night, and that keeps my oxygen saturation in a safe place between the low to mid 90s.
Yeah, that's so bad. Yeah.
I'm on 2 liters.
You're on.
You're on 2 or 3 liters, Daisy.
Okay.
Yeah, I'm not on oxygen because saturation is not an issue. I'm on BiPAP or non-invasive ventilator because my lungs are failing themselves, like structurally. So we all have lung issues, but it's happening the opposite. Saturation is an issue when I had pneumonia for sure. Saturation obviously goes way down, but I'm on full nighttime ventilation to keep my lungs moving because at nighttime the graph of how much oxygen I lose and how less of, how few of breaths I take just gets wider and wider. So they're trying to keep my lungs as strong as they can be for as long as they can be with the ventilation.
Yeah, breathing pauses are a problem for me, both day and night. They're becoming more profound. I'm noticing myself more so during the day having more breathing pauses than I used to as well.
Pauses. Now, by pauses, do you mean like a laryngeal spasms, or are you talking about you just holding your breath for some reason?
I'm not holding my breath. It's just that my physician referred to it as breathing pauses, where there's a delay between each breath and it gets farther and farther out.
Yeah. Okay.
Your brain's not telling your body to breathe.
Right. Exactly.
Yeah.
I catch myself gasping a lot during the day.
Which means it's MSA is in your spinal cord because the timing of everything autonomic originates from the brain but goes to the spinal cord. So when we start having these delays, we know our spinal cord is now becoming involved as well.
Yeah, neurology is telling me that I have a combination of MSA, P, and C. So,
Yeah,
which
They
makes
usually
sense.
mix.
which correlates with what we're talking about.
They usually mix when you get further along.
Complicated.
Yeah. So what is your worst symptom that you have, Paul?
The top 3 worst for me: bowel, bladder, and REM behavior disorder.
Yeah.
Now, do you have a catheter at all?
I don't cath. I'm not able to cath right now because I have an enlarged prostate, which is another structural issue. So
Yeah.
the urodynamics test, they had difficulties performing, and
That sounds
fortunately,
like a Mayo Clinic test. The way he said that.
you had the same issue.
Yeah, absolutely. Yeah, my urodynamic flow is spasm. They're able to see all the spasms. The tremors we speak about are those internal spasms
Yeah,
that you don't see but you feel. And yeah, I had like 30,000 spasms or whatever. They can see with that test.
The phone on vibration and stuff.
Yeah.
yeah. So those are my top 3. For the past 3 days, the medication for bowel and bladder have not been effective for me.
What do you take your bowel?
Well, for bowel, I take Linzess in the mornings, and it's supposed to work and be very effective. I take 144 um, milligrams of Linzess.
I take 200 of that in Constellos.
And what?
Constellos?
Okay.
Actylos?
Mm-hmm. I
I still have problems.
take a series of stool softeners and Miralax and such.
That stuff does not work for me.
And doesn't work for me. My best bet is Linzess. It's either going to work for me in the mornings or it's not. And I've been 3 days in a row to where I can feel everything liquefying in my digestive tract with the Linzess, but nothing moves. It just sits there.
I think the only thing that keeps me going with my bowel movements is that my NIV breathing machine at nighttime, because I have a hole in my vocal cords, so it's forcing air down my entire large intestine. So I have so much gas that if I didn't have so much airflow bottling up in my body from my ventilation machine, I would be stopped up. But since I have so much gas, basically, it's able to keep pushing it out regularly. So if it wasn't for the machine, I would be like before. I'd be completely constipated, backed up, not going to the bathroom for like a week or two. It's crazy.
So the
Validity
sleep
is
study
gone.
doctor had me try a BiPAP, and with the BiPAP, I started regurgitating bile really
Yeah.
bad. So they lowered the pressure setting to the lowest setting, and I still regurgitated bile. So they ended the BiPAP because of that.
Did your ENT or your ENT or your pulmonologist tell you that that reason is because your muscle weakness down here towards your esophagus?
Yeah.
Because that's why I've had that too. One time I regurgitated in my mask. I didn't throw up, but it all came up to my mouth one time. But before that, I had some like acid reflux and heartburn, and they were telling me that there's cells in my esophagus that weren't supposed to be there. They're supposed to be in the stomach lining, but that the muscles at the bottom are so weak that is allowing the liquids, like you said, to come back up and regurgitate. And the only thing they say they can do for that, besides some medications, which probably won't work for very long, would be Botox, which has helped, believe it or not, and also the surgery to help with that.
Yeah. Botox
Personally,
therapy. I'm using Botox for my hands. Um, my my fingers are locking up. My hands are cramping.
it's very painful, don't it?
It's extremely painful, and I use
Makes me
Fit
want to cry.
at night for one hand at a time because you can't really brace both hands at the same time and sleep and have to get up in the middle of the night or something. So I pick one hand or the other and use the brace on it to keep the fingers from locking up on that particular.
And so you the hand down, lock them.
But the Botox therapy, the MSA neurologist is hopeful. He's using it on his patients, where he'll inject Botox in the forearms, finding the muscles that control the fingers and injecting Botox in those and having it repeated every 3 months. And so I've had one treatment so far, and then I go back the end of July for my second treatment.
I've been doing Botox since 2021, and it works really well.
Yeah, I got my Botox because of Daisy, right? I mentioned to my pulmonologist, said by the way, my fellow podcaster has said she gets this and that, and I encourage you, Paul, to ask for Botox if you keep getting that regurgitation, to ask for that for your
Yeah.
throat muscles. Yeah, absolutely. It has greatly helped me, Paul, and for me, I mean, I can't stress to you how much it's helped. Now, the one thing I do want to ask you is, have you noticed that the medications that you had have been taken and are taking, that they're starting to wear off and no longer work anymore?
I'm finding that most of my medications, I'm having to increase the dosage in order for them to be effective.
So my pain medicine.
Pain medicine. There's so many different types of pain that we get from MSA. But I asked that because my MSA neurologist told me that. She says, don't be alarmed when one day this medication works and the next day it doesn't. And it's true. I mean, I'm swapping medications about every 6 months now at this point, because what used to work absolutely wonderfully no longer works at all.
She gave me 50 milligrams more of Botox.
Really. Yeah, I have to go back for Botox as well in a month or two.
Yeah.
So,
And that I take 600 milligrams 3 times a day and take baclofen 3 times a day.
yeah.
And my palliative care physician recommended that when I had really bad spasms is to take an additional Klonopin during that time. So
Yeah.
your recommendation of your drug, I'll definitely take a look at it and see if that's an option for me for when I have really bad spasm attacks.
So you're talking about the Keppra?
The Keppra. Yeah.
Yeah, I maxed out. I'm maxed out on 4 or 5 milligram at nighttime. It does not phase me one bit at nighttime at all. But Keppra has seemed to knock down the myoclonus jerks and most of the REM behavior disorder.
Yeah.
Paul, ask your urologist about Botox in the bladder because I wish I would have went with Botox in the bladder first before I got some catheter.
I
But
certainly
yeah,
will.
may give me some sewer bladder again.
I'm real fortunate in that VCU has a MSA Center for Excellence. I believe there's 33 perhaps roughly, and it's about an hour and a half from home. So, and there's medical transportation that will take me there and back, which is extremely helpful. But the multidisciplinary component of having a center for excellence is paramount, I think, because all of the physicians are working together in lockstep to help treat your individual symptoms. We all have a lot of similarities, but we also have some one or two offs as well.
Yeah.
So
Yeah.
having
For the record, Paul speaks about Centers for Excellence for MSA. So everyone's not confused. Like, for instance, I go to a Center for Comprehensive Care, CCC, which is more common. It's not that one offers more than the other, but obviously his has trained professionals for MSA. Mine does as well, too. Everyone that I go to see IU Health for the Comprehensive Care Clinic knows about MSA and atypical Parkinson's diseases. So they're fully trained on how to do stuff. So, even if you can't get to a Centers for Excellence for MSA, definitely look for a CCC, something that's comprehensive care clinic, because they put you in this category for extreme need, extreme care. Usually these events are like every 6 months. They have these clinics for you to come by, and they'll treat you in one day, all your symptoms, and get you ready for social, physical, emotional, mental, psychological. They'll get you set up on a lot of treatment plans and whatever help you may or may not need.
I wish I had one.
definitely, yeah, I have a MSA neurologist, an autonomic neurologist.
I had a really good one, Dr. Law, but I sure miss going to him. He did so.
Gastroenterologist, urological neurology.
Yeah.
And then they also offer psychological care as well as physical therapy and other forms of treatment that I get more locally here through my own network, because I can't drive to physical therapy or be transported, an hour and a half each way just for physical therapy. So I have more local physical therapist that I work with. And then I go to aqua therapy independently in Westminster, Canterbury, which is a retirement community. Up the road, they offer seated exercises for Parkinson's patients, and it's a
Mm-hmm.
free service to the general public. So I'm able to
That's
tap
awesome.
into that as well. And they have
That's awesome.
LSVT Big and LSVT Loud, and
I've had those.
for Parkinson's patients who are residents at Westminster, Canterbury.
Yeah,
Oh,
Daisy, that's why I keep telling you to speak loudly and move your voice, because of the LSVT for Parkinson's is what they give MSA patients to help them speak with an intent and like basically yell across the room. So that's why I keep yelling at Daisy, because I went to that whole seminar. It's like 5 weeks of it, and they have this year they've updated it again. So there's another 5 weeks of learning for the LSVT for Parkinson's. So yeah, either you understand what they're trying to tell you, or you just don't get it, right? If MSA, we lose our vocal cords, like mine paralyzed, my left one, we lose our muscle speech. I think we understand that we have to slow down and speak louder with intent, or just it's right over our head. We don't get that. So that's what the LSVT is all about.
Paul, what kind of advice would you give somebody diagnosed today?
I didn't understand, Daisy.
What kind of advice do you have for a patient that gets diagnosed today?
Kind of
Advice do you have for somebody that gets diagnosed with MSA today?
What type of advice would you give to somebody who is diagnosed with MSA today?
wow.
Because
Don't let MSA define who you are as an individual. Remember who you were before you were diagnosed with MSA. Enjoy the things that you enjoy doing
Well, it's all right.
within your limitations. Be creative. Find purpose in life so that you can feel a sense of
Feel regarding
achievement or accomplishment. Just don't give in to MSA and let it dictate to you what to do and what to eat, where to go. David, you mentioned travel. We're looking at different avenues for accessibility, and the national parks have tracks, power chairs that have like
yeah,
tank
tank
tracks
tracks.
for layman's terms. And so you can explore the parks just like anyone else can. And so I'm looking at ways to being more present because I'm extroverted by nature. So to be at home is all day long would be like the worst scenario for me.
Yeah.
Worst case scenario. So, I have installed a lift on the back of the truck. I had to save money and pay for that myself, but I have a ramp installed on the back of the house. And so I'm able to roll out, ride up onto the lift and strap it down and go down the road, either if I'm driving or as a passenger.
I
So
have
I'm
a bit of
still
advice
able
for
to go out. And I'm finding that music venues, restaurants, and other places are becoming more accommodating than what they have ever been before. And I'm grateful for that because, I've been to concerts recently. I've pretty much been as social as I have been before being diagnosed with MSA.
There's no way you've gone to a Cracker Barrel recently and gotten through that lobby with all that merchandise in a wheelchair.
Well, that or market.
Yeah, yeah. I was like, probably the one place you will never fit through is Cracker Barrel, the lobby.
Yeah. Yeah.
David.
Yeah,
I
go
have
into
some
a
advice.
world market where they put all the Christmas ornaments up at the front that are so close together in the aisles.
Yeah.
Yeah. So there
David, you need a power
certainly
share.
limitations, but
So, yeah.
You need to get a power share while
Oh,
you can drive it. Don't you agree?
who needs to get a power chair?
You.
Hell no.
Oh, you can still drive it.
I'm
So
gonna,
you can learn how.
I'm gonna walk to my grave.
So you can learn how to use it.
Don't need to. I want nothing to be associated between me and a power chair.
I would have loved to have been able to walk through an airport, David. I flew a lot back in the day and I tried the time before last and couldn't make it to the gate and
Yeah.
I needed assistance. I was literally staggering in the distance from the right side of the hallway to the left was too far for me and I was stumbling and falling down and people were stepping over top of me trying to get to their gate and
Yeah.
could care less about me laying on the floor.
Well, I mean, you said it earlier. It's the mental part of MSA, mental fatigue. If there's one thing you will never see from me is not. I have to say this the right way. Everybody gets tired, everybody gets fatigued. Everybody gets, sick and has issues with MSA differently. But I will always walk through that airport, even if it costs me a day and laying in a bed or a couch or something, recuperating, because I can't allow myself to take that hit. Right, and my wife and my mom, my kids are like, get the wheelchair, get the wheelchair. But no, I will continuously, I will walk it no matter what. I will walk drunk. I will be proud to be walking drunk. But I have other mental things I'm getting tired of besides walking. Walking, I know if I keep walking through these airports, I will physically be able to keep walking. I know that for a fact in my case. But you know, there's other things that I'm mentally tired of. You know, my facial masking, my vocal cords going out, my speaking going, my eyesight, my lungs, my breathing, my air. I have many other things that are more important to me than asking for assistance in a wheelchair that I don't need. And by the way, when I walk through an airport with my heavy backpack with my laptop and drone or whatever, the weight actually helps me to walk. Having weight not always is a good idea for patients with MSA, but having a backpack generally, anchors my legs so I walk properly. And if not, I'll use the suitcase to walk with, and it helps. So
I use 5 pound weights to walk in the pool.
use what?
5 pound weights to walk in the pool. My ankles.
Weights, yeah, ankle weights for pool, strengthening legs. Yeah. You have to. We have to try something, because if you don't use it, you're gonna lose it. And
Don't use it, you're going to lose it. And so, walking is my first mode, assisted either with trekking poles or a rollator for the most part, unless I'm in the house. But longer distances, I'm simply not able to walk any more.
Please be
And
careful with
it's
it.
just left side weakness for me that's
Anybody
causing.
please be careful with it, or I'll get you back to this.
You must have had a bad experience with
Oh, yeah.
your Daisy.
Yeah, clinical trial screen. What do you should do?
Yeah, for me, I'm fine with it, and it gives me an opportunity to sit if I need to. You have a built-in chair, so plus I'm able to walk into a grocery store with a couple of grocery bags on the seat of the rollator and push it around to do my shopping.
You didn't have to perfect. I would just so you didn't have screen with the brain surgery. At the end of the heart, I'm on a foot forward. That is just another one of these.
I will take your word for it. But Paul, to your point about mental, being mentally strained, and to say, when I go we're on a cruise next weekend, the goal is not for me to get to Fort Lauderdale. The goal is step by step for me to walk to the gate, then early boarding to get onto the airplane and get my carry-on buff, which I can't do with my busted shoulder, right? The goal is to get off the plane. The goal is to get out of the airport. The goal is to, get into the car. So I think a lot of people with MSA and Parkinson's and cure PSP and ALS stuff, they set too lofty goals that they're setting themselves up to fail, which is causing mental fatigue, like you say, Paul, mental strain, like mental depression, because they can't do these things because they're trying to conquer the world all at one time, like Napoleon. No, you have to do one thing at a time. And yes, Paul, I've sat down plenty of times in the airport. I stopped plenty of times in the airport. I have to decide: am I going to take the escalator with luggage or the elevator now? And sometimes I do elevator. Most of the time, I still do escalator. Why? It's challenging because I still think I can do it. Right. So that mental fatigue, in my own opinion, is from a lot of people trying to do everything they used to do instead of chopping it up in little sections and doing piece by piece, like me walking through an airport. So I can understand where people come from with that.
My MSA neurologist told me, he said that exercise is the best medicine for MSA.
Absolutely, absolutely.
You
What
go
else?
back to what you said earlier. If you don't use it, you lose it. And so atrophy, it
It
plays a
hurts.
big role in painful,
Yeah,
both mentally and physically. You have to remain mentally sharp as well, you know?
Yeah.
you have to record your goals like you do, like also. You can't look at the big picture. It's progress is perfection, not perfection. Progress is perfection. But I lose 5 pounds at a time. So you go for 5 pounds at a time. That's what we used to do. That's it. Just it. Lose goals at a time.
Little things at a time. Yeah, seriously. Otherwise, the last thing you want to do to yourself, or Daisy, or our listeners, the last thing you want to do to yourself is lie to yourself and say, I can do this, when you know you can't do it. Right? We bought my daughter a new dresser. And it was heavy. It was real wood. You think my kids and my wife are going to get that thing up the stairs in the bottom of the home? No. David Knox has one good arm, one good bicep. He still has some muscle. And his oldest daughter got that sucker up the stairs, and we all almost paid dearly for that. I fell a few times on the stairs trying to get it up, right, on a dolly. But step by step, you can't lie to yourself and say you got this when you don't. You have to, like you said, like you do, Paul, when you go for a drive, whether you're going to walk or not. You have to know your limitations and work within them, and then at times exercise those limitations. Right, stretch them out, see what else you can do.
So it's progress, not
Adapt to what you're doing and where you're going. Right, that's all you can do. But you cannot conquer the world in one day with your actions. You have to do it
yeah.
piece by piece.
Progress, not perfection. That's what I'm looking for.
Progress, not perfection. Absolutely, Daisy. That's the truth.
But constantly challenge yourself to
Yeah, so
don't try not to lose sight on who you were before you were diagnosed with MSA.
you might have MSA,
I
but
think
you
that's
don't
really
say it.
important.
Yeah.
Look at it as you might have MSA, but MSA does not have you.
That's right.
Well, I don't know. MSA definitely has you. It has us.
It
don't,
does.
don't let MSA change who you were.
Don't let it change who you are.
Yeah.
But having other health issues that I was able to adapt to and find ways to circumvent the issues. MSA is a lot different.
Yeah.
It comes at you unexpectedly, multiple issues at the same time. And there are times you don't fully grasp the magnitude of MSA and how it affects you mentally and physically.
But you can do
It's
something today that you
it's
might not be able to do tomorrow.
really tough. With RBD, David, you have a bad night. So
Yeah.
you have little sleep. And so you wake up, with intention to perform, several things, and you simply can't do them because you're void of any quality sleep.
Yeah. You're absolutely right.
So you have to expect also the unexpected as well with MSA.
Yeah.
What you can do today, you do not take for granted because you might not be able to do it tomorrow.
Oh, I'm gonna do it tomorrow, Daisy.
Yeah, that's what
See,
you can.
now we're going to talk about mental, not fatigue, mental strength. I'm going to be able to do it tomorrow. I guarantee you that.
I guarantee it too, David. I know you've
You have to have that thought, that ideology in your mind, right? We all know what's going to happen to us. We all know, right? You're down our sleep, our lungs, or our brains into our heart to stop beating. We all know it's probably going to be peaceful. We know we're going to suffer great consequences with our body. We're going to have horrible things happen to us, and embarrassing things. Family that turns their back on us. Friends too. We know what's going to happen to us, but you don't have to have that attitude, right? You have that attitude where, yes, I will be here tomorrow doing the same exact thing I'm doing today, but whether you like it or not. And if not, I'll prove it. If you don't think so, I'll prove it to you. Like you have to be mentally strong, because like Paul, your whole thesis with this podcast, mental fatigue, it wears you down to a point to where either you can handle it or we get into drugs, alcohol, depression, suicide. I mean, pick a choice, right? We get into all these things that we don't want to. You have to be strong. Yes, it exacts a toll. It exacts a biblical toll on our bodies and our life. But if we can't manage the system and help ourselves, we go into a big black hole. Not many people can get out of that hole.
One thing that I've learned with MSA is that you can't stay ahead of it.
No, I wish.
I wish too. I really and truly do, but you can't stay ahead of it. I mean, it's coming at you. I think we just need to live each day with grace, and I believe that we should not be ashamed to walk drunk
Yep.
in a public place. If
Liquor,
we
vodka, Paul, vodka. It calms the system down, buddy. I'm telling you, it helps.
press
Paul, I really want to thank you for coming on today and talking with us. We really enjoyed it.
Did you? I've heard the question I was going to ask you.
You did everything else you wanted to do.
Do you have any other clinical trials or anything else you're trying to get into?
the international MSA conference, there were some discussions about an RBD trial. I have a device in my chest for heart failure,
Yeah.
and it's not MRI compatible, which every drug trial requires MRI imaging of the brain. So I'm up for a new one in the next year or so. And at that time, I, I have some tough decisions to make on whether or not I ask them to remove the device and the lead so that I can be eligible for drug trials, or if I can have them replace all of the leads and the device so that I am MRI compatible. Either way, it's going to be difficult. Swapping out the leads is no easy procedure. I have one that is thoracic, and I'm having more atrial issues now where before they were all ventricular.
Mm-hmm.
So I'm having atrial tachycardia and AFib on a more consistent basis, albeit short runs, but they get really, really high at times for 30, 40 seconds, and I feel real woozy during that time. And my device won't compensate for it because it's only programmed to work with the ventricles, not the atrial side of the heart.
Well, it sounds like you don't have much of a choice then.
Yeah.
If I could shed, in closing here, if I could shed a little bit of light and not mental fatigue with you, I thought clinical trials was everything. The people Daisy and I have talked to, and I've talked to people on my YouTube channel, progress is slow, and we don't have that much time, right? So, like I told my family and my mom and her husband, I said, I think I'll stick with the stem cells I had in Mexico because I'm still reaping benefits to this day, even after the shoulder surgery knocked out half of them. I'm living a much better life on stem cells than I personally think with a clinical trial. But we need people in clinical trials to study medicines and procedures and things like that. So I understand that, but don't think that clinical trials is a solution for everything and everyone. Money you spend traveling for these places, and you can easily go get alternative therapies that, like myself in Mexico, I'm going back in July, and the difference could be more stark if you see me in day-to-day life compared to before, even now. So, definitely keep your head up and think outside the clinical trial, just in case.
Yeah, definitely. Thank you.
Was there any other final wise words of wisdom? Wise words of wisdom you'd like to share with our listeners?
My advice to anyone with MSA to reiterate is to not let it define who you are as an individual. Keep your head held high, challenge yourself every day, encourage others around you how to face adversity with grace.
Yeah.
Because MSA is unforgiving. You lose your dignity in the medical setting, sometimes in public,
Yeah.
sometimes at home. You lose your sense of dignity at times.
I'll
I feel like the more that we challenge ourselves and the more that we try to do things, the longer and better life we'll have as a result.
I
This
agree.
is going to air next Friday. This is air next Friday.
Yeah, this episode will air next Friday. We should just say today, Friday, but yeah, next week. Paul, we would definitely like to have you back on to speak about more of the PTSD and anxiety that we get from all these visits, all these treatments, all the conversations we have with our doctors about the good, the bad, and the ugly. Would you be willing to come back on and talk to us a little bit more about that in depth?
Absolutely. In particular, some of the hard questions in talking with palliative care and the decision on when to include hospice care into our regime. But palliative care in particular is that's a real mental hit for me personally, because they take a look at all of the physicians' notes and compare their notes and talk about your care. And they've studied multiple symptomatry up one side and down the other to the best of their abilities. And so they have a crystal ball, and in a sense.
It's not.
My palliative care
Oh, don't get me started on Tito's.
It's all about my health care handles.
I'll raise
Crystal.
a glass for you tonight, David.
Yeah, I'll do the same for you. Trust
It's
me.
palliative care handle
Thank
your
you.
pain.
Say again, Izzy. Does palliative care help handle your pain, Paul?
Palliative care is taking a backseat approach right now for my pain, but they are available should I need it. Right now, I'm just treating the neuropathy pain at this time.
And that's what
And then I
healthcare.
supplement it with Tito's when I have
Yeah,
other.
that's my boy right there. That's what I'm talking about.
Healthcare is handle my pain.
We do not condone the mixing of prescription drugs and alcohol on this podcast.
I'd like to say that we proudly support Mission MSA.
It's a bad time to what a bad segue, Daisy.
And basically, go to Piece of Cake Challenge, Piece of Cake Challenge, and do Piece of Cake Challenge of the Ultimate Challenge for ALS. That is for USA. It helps treat our all family. Thanks, Matt.
Sounds like a plan. So, Paul, next time. Until next time.
Thank you, David. Thank you, Daisy.
Don't drink too many.
Yes.
You are an inspiration for many of us, Paul. We thank you.
Remember
Thank
that
you,
we're
David.
all MSA Crusaders.
Yes, we are. Thank you.
Thank you. Have a good night.
As we close another chapter, remember you're a factor. In this fight we're not alone. Together we have grown. With every voice that speaks its truth, we shine a light, we're living proof. Remember, we're all MSA Crusaders, and together we can make a difference.